Welcome back to Bloom. Nobody likes bad breath. We don't want to be around it, and we certainly don't want to have it. Joining us to discuss how to get rid of bad breath is Dr. Cindy Brayer and registered dental hygienist Tiffany Feger with Creating Smiles Dental. Welcome back to Bloom, ladies.
Thank you for having us.
So, Dr. Brayer, we'll start with you. What exactly is bad breath or halitosis?
So halitosis is also known as having chronic bad breath, which is a smell, like a strong odor that still lingers after you've brushed, or maybe you've rinsed with mouthwash or had mints. And this could be a sign that something more serious is going on.
All right, so Tiffany, what causes bad breath?
Well, there could be a handful of reasons, so come talk to your dentist. We can help you figure out which one or ones it is. So I will start with what is the most common. It's stuff that lingers in your mouth a long time. So if you have retainers or dentures or partials, you got to take them out and clean them. If you eat strong foods like garlic or onions, got to brush it out. Or bacteria in your mouth, or having less than ideal dental hygiene, you got to brush it out. Otherwise, the bacteria goes down into your gums, infects your tooth socket, and that is actually called periodontal disease. And diseased tissue doesn't smell good. So I have to tell you, when I was pregnant, any of the time if someone would come in with if they smoked a little bit and had what we call perio breath, then it was the worst smell for me with my sensitive nose, right? So what we would do is I'd clean it, give them a fresh start. So that's good. And other things that aren't necessarily lingering a long time in your mouth are if you smoke, even a little bit, if you drink alcohol or coffee, even a little bit, or if you have dry mouth, and that could be something from like being on TV, like a short time thing, or if you have like a medical condition or a side effect from having from your medications. So it could also be something more serious, something as simple as postnasal drip or tonsil stones, having acid reflux, something going on with your organs, or something more serious like oral cancer. So come in, and with our sensitive noses, we can help you find out why.
That's good. A lot of underlying conditions can lead to this. Dr. Burr, how do you treat halitosis?
So like Tiffany said, the first thing is brushing and flossing your teeth every day. That's critical to remove all the plaque, bacteria in your mouth. Also make sure you're brushing your tongue or using a tongue scraper that will clean all the bacteria and the buildup off your tongue. Another thing would be to check if you're, having if you were a retainer or appliances or dentures, that you've got to make sure you're keeping those clean, because those can also harbor bacteria and cause bad breath. And like Tiffany was saying, make sure you're coming to see your dentist so that we can do a checkup and see, do you have cavities? Do you have periodontal disease? Is there an infection in there? Like all those things can contribute to bad breath, and getting your cleanings. And if you've done all of that and you're still, smelling that bad breath, then you need to see your doctor, because there may be a more serious underlying medical condition.
All such great advice. Any other preventative tips for halitosis?
Yes, well, I wouldn't be a dental hygienist if I didn't motivate you to brush and floss. But you don't have to take it from me. Last week I had a high school senior, and I knew I'd be talking about this, and she said, make sure you tell everyone to floss too. So if a high school senior has enough time and priority, then we can do that too. So don't just brush your teeth, you need to brush your top of your mouth, you need to brush your cheeks, you need to brush your tongue, or with tongue scraping, and brush frequently. And that is going to really help, not just your teeth. And something that most people are concerned with, or maybe should be, is morning breath. So to prevent that, brush right before bed and also first thing in the morning, because bacteria loves a warm, moist environment, and it grows really fast. So get rid of that. And the other things, I took some notes. So if you smoke or drink, quit. So of course, that is something that if you can't quit, drink a lot of water. And we think about like mouthwashes or mints. That is not going to get rid of it. It'll just kind of mask the smell a little bit. Alternatively, we use oral probiotics in our practice. In our families, we buy it for ourselves, and that will crowd out the bad bacteria, get rid of the bad breath, and also help with dry mouth. The side effects are whiter teeth and fresher breath. So that is great.
I love
and
that.
Then brush your teeth like a lot, switch out your toothbrush, and come see us for your dental checkups.
All right, ladies, thank you. This has been so informative. I really appreciate it. And for more information, you can call Creating Smiles Dental or visit creating smiles.com online, and you can also call their 2 locations. For St. Petersburg, call 727-323-0377, or for the Clearwater location, call 727-791-8823. And we will be back with more Bloom right after this.